Doctors in Canada are being told to stay away from a batch of 170,000 swine flu vaccines following 6 reports of allergic reactions. The vaccine in question was produced by GlaxoSmithKline, which insists none of the other vaccines it has distributed around the world need to be pulled.
Analysts say GlaxoSmithKline stands to make more than $2.5 billion in sales in the next 6 months from the swine flu. And that's before the company introduces its latest product, a protective face mask. The company makes the second biggest selling drug for people who have caught the H1N1 virus and is working on a vaccine.
Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, is joining us this morning. Dr. Fauci, good morning.
Good morning.
What is your best argument for the vaccine to people who feel that the chances of me or my child getting severely sick from H1N1 is so mild that I'm not willing to take a chance with a vaccine that is brand new and may have long-term side effects that we're not yet aware of?
Well, first of all, if you look at what's happening with this pandemic right now, we're seeing that the susceptibility to not only infection but also to the complications of infection is skewed very much towards young people and pregnant women. Pregnant women have a 4 to 6 times greater probability of getting into serious trouble with influenza than people who are not pregnant. And if you look at the history of these vaccines,
and also I add to that, and I insist on repeating that one has to look at the total experience with a drug or a vaccine over a period of time, not simply what is in the FDA package circular.
So are you saying that instead of relying on clinical data, saline, inert placebo-controlled studies, we should just rely on the experience? Well, isn't it true that there's a lot of people out there? In fact, you've said used a lot of adjectives for them today so far, who are out there and say that their experience is that vaccines have caused all kinds of serious adverse reactions.
You said brand new vaccine. This vaccine is made exactly the same way as we make seasonal flu every year with decades of good safety experience.
So what's different about it? Something must be.
Health officials around the world had believed swine flu could kill hundreds of thousands, if not millions. They introduced emergency measures and spent in excess of $20 billion on vaccines. France is one country feeling the prick of embarrassment. Officials spent a staggering $1.25 billion buying 94 million doses of H1N1 vaccine. So far, only 5 million have been used. Now the country, like many others that bought big, is trying to sell off surplus stock.
Never before the search for traces of a virus was carried out so broadly and intensively. Besides, many cases of death that happened to coincide with seropositive H1N1 lab findings were simply attributed to swine flu and used to foster fear. To foster fear.
Take care of yourself. But it hasn't been the killer some predicted, when the figure of 12,000 is compared to more than 250,000 people who die of seasonal flu each year. Dr. Vodag says the H1N1 vaccine was not sufficiently tested and was needlessly exposed to millions of healthy people. Drug maker GlaxoSmithKline have responded by saying,
allegations of undue influence are misguided and unfounded. The WHO declared that H1N1 swine flu met the criteria for a pandemic.
Change the definition of pandemic. Change the definition of pandemic.
Responding to it has required unprecedented collaboration. As WHO has stated, legal regulations and numerous safeguards are in place to manage possible conflicts of interest.
Once again, as pharmaceutical companies are being accused of hyping up a false pandemic, the Council of Europe is putting the virus on its winter agenda, which is now underway. The COE's head of health also claims the World Health Organization colluded with major drug companies and changed the definition of pandemic. Change the definition of pandemic. Change the definition of pandemic. Dr. Wolfgang Vodarg says it ensured maximum profits but no risks for the firms. Now countries like Britain, France, and Germany have stockpiles of vaccines lying unused as infections spread far less than the panic surrounding it. And now let's hear from Dr. Wolfgang Vodarg, who's in Strasbourg. Hello, Dr. Vodarg. What's your evidence that drug firms created a false alarm over swine flu?
The WHO has installed a private-public partnership with the pharmaceutical companies some 8 years ago. They started, and it seems that the pharmaceutical industry is has very successfully influenced the work, because they made a lot of profit with 2 false alarms of the WHO. First, it was the birds flu alarm, which never happened. Birds flu did not exist as a disease spread from one human being to the other. And the second now was the swine flu alarm, which was just a normal flu as we experience every year, even milder than most of the years. And nevertheless, they succeeded to make such a big marketing out of it, using scientifics who were at their hand and using our governments, impressing them that they made contracts with marketing commitments which cost us billions worldwide. Yes, the WHO had a definition of a pandemic, and a pandemic is something very special, which is big morbidity and a high mortality. And this was in the definition before, in 2004, 2005. You can read it in the WHO websites and in the papers. And this year, they suddenly dropped those 2 characteristics. They said nothing about the severeness of the disease, which is spreading, and they said nothing about the mortality, which is very essential for such a definition. And as the WHO was at the trigger to give the alarm for all which was prepared before, the WHO is the institution which has the biggest responsibility in this case. They continued even telling us that there may be a second wave, although some other institutions already had found out and had documented that, for instance, in Australia, where the winter is long over, there has been none, and there is no scientific evidence for a second wave, so they continue selling their drugs, and WHO helps them, and some national institutes do this too. And it is irresponsible, it's unresponsible, because people are vaccinated without and needlessly. And it makes a damage to people. There may be side effects, and it costs a lot of money, but I think the side effects and the giving children to vaccination, which is not necessary, when it's even not proved that the vaccinations of children help something, and the vaccines are not tested with children. So there's so many things happening, and WHO is just covering all this and saying this is a good thing. It's incredible what's happening.